Welcome to the Maternity Mentor. Today we will be talking about the effects of the COVID-19 vaccine on your breast milk. Stay with us. Hi, I'm Samantha. I'm a nurse practitioner and I have over 12 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified and I have received training in perinatal mood and anxiety disorders as well as perinatal bereavement. COVID-19 vaccination is now recommended for all pregnant and breastfeeding women. With this announcement, there came a lot of questions and concerns. Let's explore what happens to your breast milk when you receive the COVID-19 vaccine and how it will affect your baby. Breast milk is a living substance that is biologically and genetically made for our babies. It's also dynamic, which means it changes constantly to meet your baby's needs. Breast milk provides for many valuable substances that benefits your baby's health, including nutrients and probiotics. It also contains a variety of substances that help to provide immune protection to infants, including lactoferrin and interleukins 6, 8, and 10. Most importantly, breast milk contains immunoglobulin A, or IgA, and immunoglobulin G, or IgG, also known as antibodies. IgG provides for long-term immunity and is the antibody that can cross the placenta to the baby. IgA helps protect mucosal areas of the body, including the sinuses, lungs, stomach, and intestines. Newborns do not start producing normal levels of IgA until 6 months of age, making the baby reliant on breast milk to provide the vast amount of IgA the baby needs. When a mother is exposed to bacterial, fungal, or viral illnesses, her body produces an immune response to make antibodies against them. If she is exposed to that illness again, her body will be able to use the antibodies to fight the infection. These antibodies are then passed through the breast milk to the baby, providing a similar immune response and protection. This is known as passive immunity and is likely a long-lasting form of immunity for your baby. Newborns can contract COVID-19. Research is still being conducted to determine how the infection is being transmitted to newborns. Vertical transmission while pregnant or during labor and delivery appears to be rare, but data is still being collected. Currently, the thought is that newborns are contracting COVID-19 infection via contact with respiratory droplets being breathed onto the newborn from mothers or other caregivers. Symptoms of COVID-19 infection in newborns includes fever, runny nose, lethargy or excessive sleepiness, vomiting, diarrhea, poor feeding, cough, rapid breathing, and difficulty breathing. It is important that if any of these symptoms are noted in the newborn, that you contact the pediatrician immediately or head to the nearest emergency room. While many COVID-19 infections are asymptomatic or present with mild symptoms, it appears that severe COVID-19 infection in the newborn often requires the use of a ventilator. A study from the University of Florida came out investigating the COVID-19 vaccination in breast milk. The results were impressive. Women who had received 2 vaccines had 100 times more COVID-19 antibodies in their breast milk than those who had not been vaccinated. These antibodies were then passed on to the mother's babies, providing them with passive immunity from the COVID-19 infection. The antibody levels were also compared between vaccinated mothers and mothers who had previously been infected with COVID-19 only, and they found that vaccinated mothers had higher levels of antibodies. A study out of Canada found that in vaccinated mothers where antibodies could not be detected in their breast milk, the breast milk samples continued to neutralize the COVID-19 virus, making it unable to inhabit living cells. Both Brazilian and United States studies have confirmed that antibody levels rise after receiving a second dose of vaccine, highlighting the importance of completing the vaccination schedule as recommended by the CDC and WHO. In Singapore, breastfeeding infants were followed after their mothers received the COVID-19 vaccines, and to date, no adverse effects have been reported up to 28 days after maternal vaccination. Providing breast milk after vaccination can help to protect the fragile newborn and infant from contracting COVID-19 infection, potentially saving a baby's life. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about why newborns are considered immunocompromised. While you are pregnant, your baby is basically living in a sterile environment. Due to the lack of exposure to bacteria, viruses, and fungi, your baby's immune system does not learn to fight off organisms, and it does not build up strength. Therefore, babies' immune systems are immature, and newborns are considered immunocompromised. Once born, your baby is no longer in a sterile environment, and their immune systems are bombarded with organisms. Babies' immune systems begin immediately to fight off infections using two cells that we all have, neutrophils and macrophages. These cells work by eating up the foreign organisms, but the problem is babies are not born with a lot of these cells. If your baby gets exposed to a serious infection like COVID-19, these cells will not be able to keep up with the infection, and your baby will get sick. As a result, babies rely on two things to boost their immunity at birth and keep them from getting sick. The first is a transfer of antibodies through the placenta prior to delivery. Second is the ingestion of breast milk containing antibodies mom is making for her baby. This includes antibodies that are produced by a vaccine the mother has received. It is very important to know babies that are fed both formula and breast milk will also receive antibodies, and therefore some immune system boost and protection. Other research is currently being conducted regarding the use of breast milk containing COVID-19 antibodies in adults. Over 100 women donated breast milk towards the research, which is showing promising results. Scientists have determined that COVID-19 antibodies appear to be able to be extracted from the breast milk and remain stable at low temperatures. The antibodies can also be stored in the freezer for years, maintaining stability. Knowing that breast milk antibodies can specifically target the lungs and gastrointestinal tract, research has been focused on developing treatments that target these areas, with a goal of reducing severity and length of COVID-19 infection. A nebulizer treatment using the breast milk antibodies is in development to treat the lungs, and a pill to treat the gastrointestinal tract. It is hoped that human trials will begin next year to test these breast milk antibody treatments. COVID-19 remains a serious illness that places mothers and babies at risk for death. I hope this has explained how maternal vaccination against COVID-19 can not only protect you, but can also protect your baby when you provide your antibody-rich breast milk. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family, and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.